Hematotoxicity is the most common immune-related adverse events after CAR T-cell therapy, and it actually occurs independent of the disease setting. So it has been described in the setting of ALL, large B-cell lymphoma, also multiple myeloma, mantle cell lymphoma, and it also has been reported independent of the target antigen, so in the context of CD19 CAR T-cells as well as BCMA-directed CAR T-cells. And we know that hematotoxicity predisposes to infectious complications, and again, infectious complications are the most common cause of non-relapse mortality post-CAR T-cell. So I think it's highly relevant, and we have published in the context of large B-cell lymphoma, utilizing commercial CAR T-cells in third line, the incidence of severe hematotoxicity, which is about 25% of the patients. And in general, also reports from others, we have about 30 to 35% severe infections within the first 30 days. And we have developed a CAR-HEMATOTOX score, which integrates neutrophil counts, hemoglobin, platelet, but also the inflammatory markers CRP and ferritin assessed prior to the start of lymphodepletion, and we could show that the hematotox score high versus low is associated with a markedly increased risk of infectious complications. And we could now apply this score, which was developed in large B-cell lymphoma, validated in large B-cell lymphoma, and we now applied the score also in the setting of multiple myeloma, but also mantle cell lymphoma, and we could again discriminate for patients with a high and low score with a prolonged time of neutropenia, so defined as neutrophil counts below 500 for longer than 14 days, and that was again associated with an increased rate of infectious complications.